Hello, everyone. My name's Solome Tibebu, and I'm the host for Going Digital Behavioral Health Tech. I'm super excited for this session with Array and Humana. Thank you both for being here. How about to get started, just some brief introductions. Dr. Parsons, I'll start with you, and then Geoffrey.
Hi, I am Taft Parsons. I am the Enterprise Medical Director for Behavioral Health with Humana Incorporated.
And hi, everyone. My name is Geoffrey Boyce. I am the co-founder and CEO of Array Behavioral Care.
Geoffrey, for those who aren't familiar, what's Array?
Sure. So obviously everyone knows Humana, but I'll give you a quick 30 seconds on Array. So we believe that Array is the nation's leading virtual psychiatry and therapy practice. What we do is we employ and really try to empower top behavioral clinicians to transform more lives. We set each of these clinicians up to work from home via video, and then we work to partner with the programs and facilities that need their services the most. Our customers are health systems, clinics, health plans, and ultimately their membership. And we specialize in psychiatry and really delivering services across the continuum, including within emergency rooms, inpatient units, step-down programs, different types of clinics, including primary care, and ultimately serving individuals in their homes as well. So our goal is really to enhance continuity of great mental health care across that continuum, and to do it in a way that brings value and outcomes to our partners and to the patients that we serve.
Great, thanks so much. I'll definitely be asking you more about that. But let me start with Dr. Parsons. So stressors brought on by COVID-19, of course, have increased behavioral health needs, but especially among older adults. Have you noticed, first off, that are they even using more digital behavioral health services during the pandemic, post-pandemic, and maybe what motivates them to do so?
Yeah, so we certainly saw our membership, our Medicare Advantage membership, utilizing a lot more digital health services through the pandemic. Some was because they were, just forced to. I mean, during the shutdown, so a lot of times folks didn't have any other option unless they were going into the emergency department in order to get that care. I've been saying that the pandemic has kind of caused more change in 1 month than to healthcare than it did in the past decade, 1 decade. And so after kind of being forced to have that first experience, what we noticed is that a lot of our seniors actually found that they enjoyed it, that they really liked the convenience. And where we saw the biggest change was in how they access behavioral health care. So as things opened back up, we tended to see a lot of our seniors go back into the office for their physical health care. I mean, to some extent, the physical exam and that part of the visit is kind of what people expect when they're getting health care. And so we saw a large shift of folks going right back into the office for their physical health docs. But what we also noticed was that there was a large proportion of our membership that on the behavioral health side, they just stuck with the virtual care. And I think it's because, you notice things like, hey, I didn't have to, go get myself ready, get in the car, drive over to an office, sit in a waiting room, maybe sit in front of a clinician who is themselves typing into an EHR and looking at a screen, and then go back home. So I think they really found that they enjoyed the convenience of being able to log on from home right at the time that their appointment was scheduled, get the same quality health care that they expected if they would have been there in the office, and log off and already be right back at home and doing their thing. So yes, we saw a big upswing in use.
And if I could follow up with, what are some of the most common behavioral health conditions that older adults are seeking treatment for?
Yeah, so, I think it's no surprise that common things happen commonly. So by the numbers, we saw, you have a lot of folks with kind of mild to moderate anxiety and depression. Through the pandemic in particular, a lot of grief and loss issues because of the increase in rates of hospitalization, death, very unfortunate, but not surprising. However, for, what we didn't necessarily see is when you just look at the volume and the numbers, it's not necessarily the people that are most in need. So what we actually found is that are seniors that have what we consider severe mental illness. So these are things like psychosis, bipolar disorder, treatment-resistant depression. We really found that a high percentage of them were actually getting their medications and their medication management from their PCP. And that very few of them had actually been to a behavioral health prescriber. And so that's where we actually saw the most need and was one of the key things that we wanted to address.
Super interesting. And speaking of addressing this big need, maybe I'll start with you, Dr. Parsons, and then Geoffrey. Sounds like earlier this January, Array partnered with Humana to bring digital behavioral health services directly to, I think, nearly 5 million Medicare Advantage members nationwide. That's remarkable. I'd love to learn a little bit more about how this partnership came to be and just how you started the conversations.
Yeah, sure. I'll start with kind of how the groundwork was laid, and then Geoffrey, you can jump in and add to that. So, we spent a significant amount of time and effort really looking at the needs of our membership and the problems that us as the insurer can help solve. So, access to behavioral health specialty care was number one. And what we also found was that even when people had that access to care, it wasn't necessarily coordinated with the rest of the members of the healthcare team. Our membership is spread across the entire country, so flung far and wide, and they tend to live in areas that are what we call whole county shortage areas. That means there's not a behavioral health provider within the entire county that person lives in. And so our initial discussions were really to look at a national provider who could work at scale to provide a meaningful solution to access to care and coordination of care. We used a standardized evaluation process, and Array really rose to the top.
Awesome. And Geoffrey, anything you'd add to that?
Yeah, just maybe add a couple of pieces of color around the edges. So, as we work through that RFP process, I think one of the things that we noticed was that it really felt like Humana wanted a partner to sit at the table with them and really figure this out and find the best solution, right? There wasn't this pretense that everything was already perfectly figured out. We weren't just another vendor going through a perfectly scoped RFP process trying to check boxes, right? I think the scope and the opportunity really evolved and crystallized over several months of discussion. And I think through that discussion, we started talking about the things that were most important to Humana and to their membership. And frankly, some of the things that I think Array had to bring to the table with this kind of high quality clinical services and a real team-based approach to it, real tight program management, the ability to really focus in on kind of guaranteed capacity and timely appointments, particularly that first appointment. We both really wanted like real data sharing where we could make sure that the services that we were offering were kind of whole person focused and making an impact ultimately. We really wanted to talk about like collaboration and member activation. How do we make sure that members know that this is available and how to access it? And, we really had to have great clinical quality programming and getting to the point where we were able to demonstrate outcomes and that this was making a difference. And so I think because of some of the work or all of the work that went into those early discussions, the implementation went pretty smoothly. And we were thrilled to be able to start 2022 in January with this service being available to all those Humana Medicare Advantage members.
And Geoffrey, this partnership actually builds on a longstanding digital behavioral health relationship between your two organizations. Why was older adults an important population for Array and Humana to work together on next?
I think Dr. Parsons touched on a couple of those ideas in some earlier comments. Obviously, this is a population that is only growing and all within healthcare. We need more effective and more cost-effective solutions to serve these members. And when you think about it, the unique needs of our seniors really stands out, particularly within the context of this post-pandemic world, right? Now more than ever, our seniors need really high quality behavioral services. They're coping with some pretty significant medical issues and behavioral issues simultaneously. There's often sort of this complex web of social factors that need to be taken into consideration. And as Dr. Parsons touched on, particularly today, they're dealing with more and more challenges around illness, isolation, grief, and loss. And I don't know about you guys, but I've never found our healthcare system to be particularly easy for anyone to navigate. And I think in today's world, it might have gotten a little bit harder, right? Where we've got this new mix of all these different options, virtual, in-person, hybrid, fully digital solutions. And so I think what we really wanted to do here was at least simplify a part of that equation and make these telebehavioral health services just really easy and really accessible with timely appointments, great support around those appointments and the program as a whole, and really many options in terms of selecting great providers, including psychiatrists who are truly accessible, in addition to great licensed therapists.
I'll just add that, I think that the easy part for us was that, Humana is mostly Medicare. So that is the lion's share of our membership. But, I think, when you look at kind of digital healthcare and in particular, digital behavioral healthcare, initially when the seniors were not necessarily the focus of some of those initial efforts. And so, we've seen a lot of kind of solutions really targeted towards the commercial population. But to Geoffrey's point, the Medicare Advantage population is doing nothing but growing. They have existing needs that are increasing over time. And I think that there has been a recognition that this is an important part of the market for digital solutions to really start addressing, especially as the technology gets better and easier to use.
Thank you. That's really helpful background. And Geoffrey, how are Humana's eligible Medicare Advantage members using Array's digital behavioral health services? Or what's something you wish each of these members knew more of?
Well, I think it's actually pretty simple what I hope folks would know more of. I would hope that every Humana Medicare Advantage member knows that help is available and that quality behavioral care services are accessible in your own home, right? And a lot of these things that were barriers, right? Transportation, arranging caregivers for that travel, needing to physically navigate a clinician's office, and some of the issues and potential anxiety that can come with seeking care outside of the home, well, those just don't have to be barriers to your wellness anymore. And so I hope that that's something people know and take advantage of.
And I asked you two questions in once there. So tell me a little bit about how are members actually using the digital behavioral health services?
Yeah, so we're offering a mix of both psychiatry and therapy directly to individuals in their homes. Folks can have the option of booking appointments directly or can use our care navigation intake service in order to get matched up with the right clinician to service their needs. We're finding a lot of interest in psychiatry and medication management, as Dr. Parsons said a little bit earlier. We love to combine psychiatry with supportive therapy where appropriate. And so, we use our care navigation team and general case management to really talk to these members and understand, hey, what services are you looking for? How are you being referred to us? How are you coming our way? Then how do we get you linked up with the right clinician who would be a great choice for you for ongoing care, right? These are not sort of acute interventions where they're just seeing one clinician one time and then going on somewhere else. We're really trying to get them matched up with the right psychiatrist, psychiatric nurse practitioner, or therapist for members' needs on an ongoing basis. And they're able to access it on their own device straight from their own home.
It sounds like you've really thought through so many aspects of really making this partnership quite integrated. And you've checked a lot of boxes on all sorts of fronts. I'd like to ask both of you, maybe Dr. Parsons first, what lessons have you learned so far?
I always say that there are always lessons to learn. I think one of the big things is, that we've found that the need is quite significant, probably larger than any of us anticipated right out of the gate. As is the specific need for behavioral health services. However, that being said, kind of the other thing that we've noted and are really kind of working on is that it's not kind of like the movie Field of Dreams, where if you build it, they will come. You really have to actively work to make connection points so that members who are most in need actually can get those services from Array. So kind of working to figure out, where is it that we, Humana, contact and touch our members, and how can we, if we identify that that person has behavioral health needs, how can we facilitate those connections to Array, so that the folks that are most in need aren't kind of left out there, not being able to access the care that, to Geoffrey's point, is available to them.
And same for you, Geoffrey, same question.
Yeah, I think I'd maybe elaborate a little bit on a point Dr. Parsons was making is this idea of kind of properly balancing supply and demand on a state-by-state basis, right? And that might be less a commentary on this specific population or this specific program, but it is a commentary on challenges in our country's healthcare system as a whole, right? And the way that we regulate it, right? When you're launching a program like this on a national basis to make licensed professionals available with rapid times to first appointment, you got to think really hard about how to do that supply and demand and balance. And you have to remember that these clinicians are not readily and entirely interchangeable. Like, not only are they unique and different people with different areas of specialty, expertise, and availability, but you got to pay attention to their state licensure, and you got to make sure that they're licensed in the state where the patient is sitting, right? And since we're not a network, right? Array is a practice. We're really devoted to being thoughtful about which clinicians we offer, where, when, and how they work with those members. And so in doing that, we really have to be looking 90, 120 days out on the horizon for some forecasting on a state-by-state basis. And that's hard to do in general, but it's particularly challenging, in today's world. And so I think that's a challenge that, we're working through with Humana, as Dr. Parsons said. A lot of it goes to making sure that the members are educated on what options are available to them, and that they're primed and prepped for those right appointments, because we don't want to have tech glitches or unnecessary snafus once somebody does get kind of connected and is ready for those services.
Like I mentioned earlier, this is a really well thought out partnership. To be able to execute on that at a national scale is no easy feat. It'd be great to hearing the level of commitment, engagement, support from your respective teams that really helped make this a true partnership.
Yeah, I think I'll say that team is probably the right word. We've had a very diverse group of folks from both Humana and Array come together at this point over a pretty extended period of time to get the partnership kind of up and running. And then, we're continuing to work to make the experience better for our members who are also Array's patients at this point. So, I think team is probably the key word there.
Yeah, and the question and Dr. Parsons' comment just gives me a chance to brag on our Array team members a little bit, right? One of the best thing about Array is the people that work here, including all the administrative team members and our great clinicians. And so one of the things that I think you can see when we do programs like this and start to get real world feedback from those folks that we're serving, we can see the passion of the team members that are working on projects and programs like this. And how every time there's a little success story that comes through, the group just gets a charge and gets motivated to, figure out whatever the next challenge or hurdle is so that we can do more and more of that. But it definitely takes collaboration. I think we've been really fortunate to work with a group of also passionate and energized and innovative folks within Humana.
Geoffrey, you alluded to trying to prepare as much as possible to make sure there's no stumbling out of the starting blocks. Can you talk a little bit about some of the clinical or operational aspects of your organizations that you had to work through before launching in January, or what did you have to troubleshoot to ensure that you'll be successful?
Yeah, I think there's a number of things. A couple that come to mind, really might be around this idea of properly positioning supply and demand into the right states at the right times. And so I think that is something that our teams worked considerably on during implementation. There was a lot of thought that went into that. And I think Humana was, ready, willing, and able to supply some great data on that. But I think one of the things that we saw is that that's a really hard thing to get perfect, right? And so I think we were surprised in some instances where we had states that had slightly more utilization than we expected, while others had less utilization than we expected. And so I think we've been working together to reposition some of that supply that might be underutilized in one place to be able to serve another, And I think we've been working with Humana to really enhance that member education and activation in some other states where they can get to those readily available clinicians that are already licensed there. So I think that's one thing that we are continuing to work with one another on. I'd say maybe with the benefit of hindsight, I think we might have liked to have better anticipated some of the additional complexity in helping adults with maybe slightly less technology experience access their care, right? I think there have been some instances where there was some confusion about telephone versus video and who is initiating the call to whom. I think, we've learned from that experience. There probably have been some instances where we've had some no-shows that could have been avoidable and have caused some people some frustration, but I think our teams are on top of it and they're going their extra mile now during the intake process to really set proper expectations about the technology and how they're going to do their session. I think more times than not, it has been less about the true technology itself as it has been about setting the right expectations and sort of getting everybody properly prepped for that first session.
And given these last few years and a lot of firsts for a lot of folks, that makes a lot of sense. I'd like to ask you both this question, but maybe Dr. Parsons, I'll start with you first. Which indicators are your teams watching closely to ensure Humana's Medicare Advantage members really have a positive digital behavioral health experience?
Yeah, so multiple. We'll start with the Net Promoter Score, which is kind of I don't know if it's universally accepted, but it's widely accepted kind of as a rating of how good or poor the customer experience is. And so we follow that with Array, but it's something that we use with many, if not all of our vendors, because we really want our members to have that good customer experience with kind of any partner that we have where we're saying this is, we're Humana and we're partners with Array. Beyond that, we have Power BI dashboards that really look at, kind of some of those process things that go into our service level agreements within a contract. That's been up and running for quite some time. And so now we're kind of getting into the stage where we're getting the claims data back in and accumulating kind of enough to start looking and see, are we getting access for the folks that we thought we would be getting access for? Are they getting the prescriptions? Are they are they adherent to the prescription regimen? So we're starting to get that level of data. Ultimately, I think we want to be able to move towards, looking at a deep, rich set of outcomes data. But it's going to take a little while before we get there. So, I think we're kind of adding to the measures that we're following as we go along. But I think, it starts with a basic one like NPS, moves on to the data that we get from claims. And ultimately, we're going to be looking at how we can advance data collection and data sharing to really look at quality outcomes.
And Geoffrey, anything you'd add to that as well?
Dr. Parsons said it really well. The only thing that I might add in there that I think we're paying attention to, particularly on the early stages of this program, is that subjective or qualitative feedback that we might get from members or our own team members that are involved in the program along the way, right? We believe very heavily in NPS as a valuable metric, but we also love to read those comments. You can get a lot of detail around that person's experience and you can learn from that and apply it. So I think paying attention to the individual qualitative feedback is also important.
Yeah, and Dr. Parsons, I'll ask you more broadly first, and then Geoffrey, same question. Without stating the obvious, of course, COVID-19 has been a real pivot point for digital behavioral health, but would love to know what opportunities or innovations has your organization embraced to continue widespread and sustainable adoption of digital behavioral health services really across all of healthcare?
Mm-hmm. So, I will say that, despite a lot of recent activity and attention kind of in the digital and particularly the digital behavioral health space, it's still kind of in its infancy. Like all this stuff is pretty new. And so as a payer, we have a lot of things that we consider problems that we need to solve for our membership. In evaluating those solutions, what we're seeing is that there's an increased number of them that are digital or have some technological aspect to the solution or service that people are bringing to us. I think pre-COVID, there was a little bit of skepticism about seniors, I'll say tech savvy, and ability to use technological solutions. But what we've found is that, our members have had a great amount of adaptability and have incorporated these things into their daily lives. I think you'd be hard pressed to find somebody at this point who hasn't utilized Zoom, or some sort of video connection to talk to folks over the last couple of years. And so, as we see those solutions increase, as people are much more comfortable with them, it really becomes a question of, are we providing things, or are folks bringing us solutions, not that the seniors are capable of using, but are their preferred solution that they use? So is it something that they're going to continue to engage in over time?
I think Dr. Parsons again said it very well. But what I might add in there is really making sure that we're, providing really high quality services. Certainly that the members are having a great experience with this, and that this becomes something that they want to use on an ongoing basis, but ultimately that we're providing really high quality clinical care that is producing outcomes for everyone. Is a thing we want to keep paying attention to and keep in the foreground as we go forward. And along with that, I'd say one of the things that we're paying a lot of attention to and eager to work on in this program and others is, how do we make sure that these behavioral services are better integrated into the primary care programs, and that there really is true collaboration across the full continuum of care, and that we're not just trying to treat folks' behavioral concerns in isolation. And so I think things like virtual collaborative care programs are things that we think are going to be critical to these digital interventions being successful for the long term.
Right. And you've already taken so many great steps toward building that in your own partnership, which now I'll start with you, Geoffrey, for this next question, and then Dr. Parsons. Where do you both see this program evolving to in the future? And what do you think's next in the digital behavioral health space?
Well, it's an exciting time to be in the digital behavioral health space, as you, of course, know better than anyone, probably. But yeah, it's fun right now. So Array's mission has really always been about transforming access to high quality care via innovative applications of technology, right? And we've been amazed and impressed by the amount of innovation that has come into our space, particularly in the last 2 years. We've been doing telehealth longer than most, and telehealth 1.0, it was all about access, right? But if you look right now at the recent intervention and innovation, the tools that are at our disposal right now are far more than just access or distribution, right? Today's digital behavioral health tools represent like real augmentations to care, right? User-friendly tools for assessment and measurement, real tools for collaboration, including collaboration between primary care and behavioral. Technology that records and simplifies documentation and member engagement and empowerment, and awesome things around clinical decision support, AI, machine learning. So there's just a massive amount of innovation that has come into this space. And what is important to us here at Array is that these new tools are used in a clinically effective and really validated way, right? We want to embrace these technologies, but we want to do so in a way that makes our valuable clinicians even more effective in the direct clinical work that they do, right? We want to make sure that they're integrated into clinical workflows. We want to have them flow sort of seamlessly with the live services of our professionals, because to us, the technology in many respects is only as good as the clinician on the other end of it, right? And so here and in other places, we really look forward to partnering with great folks like Humana to do that really responsibly together.
Thank you. Dr. Parsons, how about you?
Yeah, I don't know that I could say it better than that. I will put a couple of exclamation points on a couple of Geoffrey's statements. So one is that I think that getting that coordination of care with the PCP is going to be very important and a focus going forward. I think some of the feedback that we've gotten from our PCPs, in the past, talking about just behavioral health care in general, They describe it as a black hole. They make a referral out to somebody to see a behavioral health provider, and they get no information back whatsoever. So I think, that was kind of, us at the ground level, kind of saying, hey, we need to get the notes to the PCP. But I think beyond that, if you think about where a lot of times correspondence between two providers goes into an EHR, a lot of times it's not necessarily easy to find. Other times it's not actionable, so kind of working to make it, kind of more visible, more actionable, so that the PCP really understands the treatment that their patient is getting, I think is going to be an important point going forward. The other thing, you talked a little bit about some of the bells and things that are kind of like bells and whistles right now, but I think over time, a lot of that technological capability will translate into clinically useful data to provide superior outcomes. And so I think as the technology advances, as the EHRs get better at collecting a longitudinal health record, I think we're really going to be looking to have a much richer set of data with which to work to judge those clinical outcomes over time.
Yes, I'm really excited about all of those things as well, but I'm a bit biased. So, well, this is not easy to do. It's just remarkable, your partnership already, how many folks you've already impacted. As you know, so many people are struggling, but especially older adults. So I really want to thank you both for the work that you do, that your teams do each day, and for joining us to tell us a little bit about it.
Yeah, thank you. It's been a pleasure.
Yeah, it's a pleasure. Thank you so much for the opportunity.